across the board, when I tell parents and kids, when they're sitting in front of me, if they have any sort of attention concerns, behavioral concerns, focus concerns, anxiety, I mean, so many kids are suffering from anxiety nowadays. And when I tell them that 80 to 90% of the serotonin in their bodies is made by their gut microbiome, right? And then usually there's a pause and parents and kids are like, what? Right? So that's a perfect segue into, listen, let's think about all the things that are happening that are disrupting your gut microbiome. And so that's an easier in to say, let's look at the food.
Lisa, it's so great to have you on the Doctor's Pharmacy podcast. We've known each other for 20 years now, maybe.
Pretty much,
and we met at a conference years ago on food as medicine. I was speaking, you were in the audience, and I think it had an impact on you because look at you now. You just came out with this great new book, Healthy, Happy Kids, an integrative pediatrician's guide to whole child resilience, and our kids are definitely not resilient today.
Yeah. Well, I just, I really want to thank you because if I hadn't met you back in, was it 2001, whatever it was, I probably wouldn't be doing this today. And I say that in all honesty. I mean, you really are one of the pivotal moments in time where, they say when you're ready for the right teacher will come. And that was it. I was fresh out of residency, kind of thinking, I don't know if I really want to do this, right?
Yeah.
I spent all this time, and then hearing you speak and really thinking about the power of food as medicine. I've never heard that concept before, never heard of functional medicine. And I thought, that's what I want to do.
Yeah.
I'm doing it.
It's interesting when I hear this story a lot because, we go into medicine wanting to do good and usually caring about helping people. And we learn all this science, and we learn all the biology, we learn all the drugs and all the diseases.
Yeah.
And we think we're equipped to really help people. But when we get out there, we go, it's sort of not like I thought it was. The landscape isn't the same. And we thought that we would be doing things that would actually be making a difference. But often what we're doing was just medicating people and naming the diseases and then giving the drug for that particular condition. And it really didn't solve the problem. And so, I hear this from a lot of doctors. Like when they hear the paradigm of functional medicine, they go, God, this just makes so much sense. Like this is actually what I wanted to do. Yeah. This is actually what medicine should be. And what you've done, and you're a pediatrician, is take this body of knowledge, which hasn't really been well applied to children, and you've really taken that on and been a leader in the field now of functional and integrative pediatrician care.
That is my mission because, as a pediatrician, you have such a golden opportunity. I mean, you have this kind of unwritten map in front of you, this beautiful child that you want them to have the best chance in life to be as successful, thriving as possible. And I'd say that the biggest contrast when I try to explain to families what the difference between a functional medicine approach is versus a conventional pediatric approach, we need conventional pediatrics. We need to have medications that are necessary when they are, and conventional medicine is great at putting out fires, but it places us in this disease-based model. So as parents and as practitioners, we have in mind, oh my gosh, I want to prevent this from happening to my child. I want to prevent this disease. And when we look at functional medicine, what we hold in our mind is that picture of a child thriving to their optimal potential. And we move towards that instead of running away towards something. So it's a subtle mindset shift, but it's the only way we're going to make a difference in kids' health.
It's so important. And I graduated in medical school in 1987. I trained in family medicine and took care of kids. The amount of disease in kids now is staggering.
Yeah.
The amount of chronic disease is staggering. 1 in 10 kids has ADHD. 40% of kids are overweight. 1 in 4 teenager boys have pre-diabetes or type 2 diabetes. We used to call it adult onset.
Yeah.
Depression, suicide, behavioral issues, ADHD, autism, they're just exploding. We had Suzanne go on the podcast the other day, and she's a pediatric neurologist, and we've gone from like 1 in 10,000 kids with autism to 1 in 36 kids today. And I remember giving talks about this 20 years ago. It was like 1 in 100 now, and then it was 1 in 69. Now it's 1 in 36. It's like, what's happening with all the allergic disorders, autoimmune diseases, gut issues, behavioral issues, ADD, mental health issues? What's going on that our kids are now so sick? I get it if you're like 70, you get chronic illnesses, but you shouldn't really then either, but if you do the right things. But I mean, this didn't happen.
We didn't. We
So
didn't.
what the heck had happened?
Yeah, it's time to wake up, but it was time to wake up decades ago. Part of why I was so drawn to functional medicine was that New England Journal of Medicine study back in 2005. I mean, this is 20 years ago, where researchers noted that for the very first time in history, our kids are expected to have shorter lifespans than us, their parents. I mean, first time in history with all of our medical advances. And so we should have woken up then. And that was entirely due to lifestyle related diseases. I mean, even during the pandemic, the World Health Organization said that 8 in 10 people die of non-communicable lifestyle related diseases. And so when I think about, what's going on with children, why have things changed? Because like you, I mean, I don't ever remember a kid puffing away on an inhaler or carrying EpiPens. And there was no such diagnosis as sensory processing disorder. Now, so many kids have sensory issues. And when I volunteer in my kids' classroom, it's heartbreaking to see the number of kids who are, rolling around on the floor, not comfortable in their bodies or their brains, and on field trips, carrying bags of medications for these kids. So I think fundamentally, not to be simplistic, but I really think that at kind of that deeper, truly root cause level, our kids' microbiomes have completely changed. I mean, when you look at the protective factor of breast milk and Bifidobacter, and we know how important Bifidobacter in that developing infant microbiome is to supporting those butyrate-producing species like F. prau and Rosaburia. Well,
those are bacteria, folks, if you don't know what you're talking about.
They're the good guys. The good guys.
Gut bugs,
the ones we want.
Happy
and we
bugs.
want a lot of bifido. But the breastfed baby of today, their gut microbiome looks much more like the formula-fed microbiome of the baby 100 years ago. I mean, there's been a drastic shift.
Formula-fed microbiome?
Yes.
Of 100 years ago? They had formula 100 years ago?
They did, yeah. And so when you look at that, this loss of all of this Bifidobacter and the loss of butyrate, which is, it's a postbiotic, right? Our master regulator of health. I really want to see more research on that, because I feel like if we could shift that, and we know that Bifidobacter is really important. When we lose Bifidobacter, we tend towards a TH2 skewing of our immune system. So that means, guys, more eczema, asthma, allergies.
Yeah.
Guess what? We're seeing an explosion, right?
Yeah.
We can see a TH17 skewing. That's autoimmunity. And guess what? The age group with the largest increase, like double the rate since the 80s, triple since the early 2000s, the rates of autoimmunity are exploding in our 12 to 19-year-olds.
Yeah.
Why is that, right? That's sort of, at that underneath level. But why are their microbiomes changing,
our gut
right?
messed up? But wait, just to be clear what you're saying breastfed kids today don't have a good microbiome because there's something changed about the breast milk?
Possibly.
Because you say formula, it's the same as formula-fed kids 100 years ago. Well, were formula-fed kids' microbiomes okay then?
Well,
I don't think so.
Back then, babies' microbiomes were nearly 100% Bifidobacter, which is not the case now, right? So, I mean, we can think about why that has occurred. I mean, even during the pandemic, there was a research paper by Dr. Hazan that could predict that people who had lower levels of Bifidobacter had more severe COVID outcomes. So there's something, about Bifidobacter that really is helping to inform our immune system. And in those early infant stages, that 0 to 3 years of age, that critical time where your microbiome is literally kind of imprinting your immune system, setting the stage for either optimal immune development or suboptimal. If we don't understand the factors to start with a healthy gut microbiome in life, it's a lot harder to change later. It's not impossible, but it's a lot harder.
I mean, you devote a lot of your book, Healthy, Happy Kids, to the gut microbiome. And it's really how you start out as the fundamental way that things are being dysregulated. And for people listening, as we've heard many times on the podcast, that the gut microbiome is linked not just to allergies and autoimmunity and eczema, but also to obesity, also to mental health disorders, also to ADHD, autism, learning disabilities. So the microbiome is huge across the whole spectrum of the things we're seeing in kids today. And there is an incredible phenomenon that's happened, which is a wiping out of this particular species called Bifidobacterium infantis, which is, I think, what you're talking about. And infantis means infant. It's like, right? And it comes generally from the mother, right, gives it to their baby as they pass through the birth canal.
Yep.
But the problem is we've given so many antibiotics over the last 60, 70 years to people. I don't think there's a woman on the planet who hasn't probably had antibiotics, or maybe for certainly in America, who hasn't had antibiotics at some point in their life. And these are super sensitive bacteria that just wipe them out. So even if you're giving a vaginal birth, these kids still may not get this.
Yes. Yep.
And there's actually a company that has actually created this strain. It's a baby probiotic. It colonizes the gut, because often, and this is, I think, so important for people listening who are having kids or planning to have kids or have grandkids or about to have grandkids, that this probiotic should be a mandatory part of prenatal care and early infant care, because it's easy to give, it's safe, and it actually colonizes, which most probiotics don't. As you get older, they just pass through. Yeah. So it colonizes, establishes, and it's been shown to actually reduce the burden of asthma and allergic disorders and all these things that you're talking about. So can you talk about why we've seen this decline and kind of almost absence of this, and how people can actually start to rebuild their gut?
And just to point out the probiotic, it's this particular one. It's great, good research behind it. It's indicated really only for breastfed babies, and here's why, because Bifido feeds on human milk oligosaccharides, these prebiotics found in breast milk, primarily something called 2FL, 2-fucosyl-lactose. So what I wish is that all babies would get not just this probiotic, but also we can now, we have manufactured 2FL as a prebiotic. I mean, that should be mandatory, because even if a baby is then formula fed, this Bifidobacter species feeds on the 2FL. It requires this. So, I mean, could you imagine a different world that we would have?
It would be quite amazing. And this is really a really simple, very safe intervention. It should be standard of care in pediatric and maternal infant child care, right?
Yeah.
But I bet you there's not too many pediatricians or even OBGYNs who even know about this.
I think the awareness is growing, but I think there has to be more of an awareness, I think, taught, really from medical school, right? On the impact of the developing gut microbiome. I mean, we know that antibiotics or antacid medications, as you noted, antibiotics, they wipe out, and some antibiotics insidiously preferentially kill off your beneficial probiotics and preserve things like Clostridia.
The bad bugs,
The bad bugs, right? And so antibiotics or antacid medications, which can do the same thing, given in the first 6 months of life, that one of the critical windows, nearly double, significantly increase the risk of virtually every single allergic disease.
Yeah.
And the same thing with
mental health. So this is all data. Disorders. This is not, you're not just making this stuff up. Stanford, NYU, UCF trained physician who understands science and has used the data to inform your opinions. It's this data that's being ignored by most pediatricians and most healthcare facilities. Yeah. And you're bringing it to light to helping parents actually learn how to optimize their kids' health and deal with some of these. Because most of the things we're talking about, obesity, allergic disorders, autoimmunity, eczema, all these things that kids have are really preventable if we start early, even before the mother conceives, and with things to do with the mother, and then during pregnancy and after. It's so important.
I'm going to guess that many of the listeners, their kids are already born, older, maybe grown. Maybe they're thinking about grandkids, right?
We've got a bunch of young listeners too. So
yes, for sure. And deal time to optimize a mom's microbiome is before you conceive. That if we truly implemented functional medicine preconception programs in every single OBGYN office, I would be out of a job, right? Yeah. Great. But what are the factors that perpetuate, this declining, this changing of our gut microbiome? You mentioned one of them, right? Antibiotics. That's the single biggest significant acute disruptor of the microbiome. In some studies, up to 70% of antibiotics prescribed to children are inappropriately prescribed, whether for viruses or maybe broader spectrum, like too quote, too strong. But the other two that are just insidious every single day, we have to point out for our children today and our teenagers today, chronic and unmanaged psychological stress can significantly disrupt the gut microbiome, can immediately, within an hour, trigger leaky gut and zonulin release. And so we need to, really figure out how are we going to help our kids manage their gut-brain connection.
So leaky gut, just for people listening, is when your barrier gets disrupted in your gut and food particles and bacterial toxins leak in and your immune system reacts, creating inflammation, and that leads to all the things we've been talking about, from
Yeah.
mental health issues to obesity to allergic and autoimmune things. So
Yeah. And then the other thing is, as you well know, one of your first books, really our ultra processed world. I mean, these ultra processed foods, the research behind the effects on children of anything lags behind the adult research, but now we're really seeing that research. So especially these food emulsifiers that can directly harm the gut microbiome. I mean, the FDA allows some emulsifiers at levels in infant formula that are known to be harmful. So, I mean, that's one thing, but then we have all of the packaged foods, the artificial dyes, the emulsifiers. And I mean, I have to cringe at some of the things that my kid says, oh, so-and-so is eating this. Can I try some too?
Yeah, right.
We have that conversation. But, that is one of the most kind of insidiously inflammatory things. And it's not even just the quote junk food. It's the foods that, we as parents, when we're trying to make healthy choices for our kids, we don't have the knowledge. Collectively, lack enough of the knowledge about how to read these labels really from a functional medicine, microbiome friendly way, so that we're really doing good for our kids. So that has to get out there. And sadly, I mean, the truth is the food industry and the FDA are not going to help us here. So we need to get the word out. Yeah,
no, we're working on, I don't know if you know this, but I'm working on a nonprofit called the Food Fix Campaign. And one of our efforts is child-friendly food labeling. So we can grade foods, like make the grade, right? A to F.
Yeah.
A is great and F you fail, right?
Yeah.
And it gives people a sense of agency around what they're choosing, because reading the front of package labeling or reading the ingredient list or reading the nutrition facts label is super confusing, and it's designed to be that way. It's designed to create confusion and misinformation so that people think they're getting something healthy when it's not.
Yeah.
I want to look back to what you said about breast milk, because it really is an important conversation. 25% of the calories in breast milk are from what you just described as these oligosaccharides. They're this type of sugars that humans cannot digest, that are only designed to feed the good gut bugs. Think about that.
Yeah. Yeah, absolutely.
And formula doesn't have it.
Yeah.
And when you look at the microbiome of formula-fed kids versus breastfed kids, it's very different. There's more butyrate-producing species with breastfed kids, which is the healthy short-chain fats, and there's more propionate-producing species with the formula-fed kids, which can cause autism and all kinds of weird things. It's a toxic metabolite. And so what advice would you give, parents preconception and women who are pregnant and then early after birth to help their microbiome and their children's microbiome? And by the way, I did do a solo podcast on preparing to conceive. From a functional medicine perspective, like what you need to do to get things ready so you can actually maximize your chances of having a healthy baby. Because it's not just your gut microbiome, it's your whole epigenetic programming that you can modify while you're preparing to conceive and during pregnancy.
Yeah.
What can parents and mothers do before they get pregnant, during pregnancy, and after to deal with this microbiome crisis that we have?
Well, and I want to also really point out, something so important that you said, that even before we conceive, even on dad's part, because we all think, it's all about the mom, right? But even on dad's part, there are so many things that we can do to help support optimal epigenetic programming to live in our modern world. That is so important. We have this power, and part of it is microbiome, part of it is psychological stress during pregnancy and before. But so for a mom, what I would say is, if you are trying to conceive, then make sure all your nutrients are optimized. Don't just take your doctor's word for it that your vitamin D levels are quote normal, because if they're at a 22, that may be normal, but it's not optimal for you as a mom pregnant and for your baby's developing immune system, for their brains. We know that low vitamin D levels in moms can increase the risk for, let's say, things like autism later on, right? Also making sure that to the extent possible, either working with a functional doc to get a stool analysis, make sure you're all clear. Yep, check your poop. Check to make sure that you have all the good stuff in, and any abnormal bacteria, any inflammation, any leakiness is addressed.
To take care of that before you conceive. Before,
because there's it's come into question whether or not the womb is actually sterile. So, but primarily, we still believe primarily the way that babies get inoculated is through the vaginal canal or, through the abdomen, right? The abdominal wall and skin if there's C-section birth. And so, that's something that we just have to make sure. I mean, are even tests that can look at mom's oral microbiomes, which we know is so important for fertility, and also vaginal microbiomes. So try kind of like head to toe, inside out, optimizing your microbiome. If you don't have a functional medicine doc to work with, then making sure you're doubling down on food as medicine for your microbiome. So we know worldwide, in the United States in particular, 95% of people don't meet fiber requirements.
Yeah.
And our fiber requirements in the United States are kind of shamefully low anyway. So you need to do that. Why fiber? Because fiber, it's the prebiotic that feeds your microbiome. 8 in 10 Americans don't get enough color. There's a color gap, right? And the phytonutrients actually can act as prebiotics and modify your epigenetic future. So, just all those things, and fermented foods and all of that. So you gotta, more than taking a supplement, which yes, take a probiotic supplement because there are some studies.
Your microbiome is really, really determined by your diet.
Yes, primarily. Yeah. Now, there are some good studies, older studies, that looked at Lactobacillus rhamnosus GG, which is the most widely studied probiotic strain in children, and found that moms who took this Lactobacillus rhamnosus GG during the 3rd trimester and while nursing, if they had a family history of atopy, like eczema, asthma, their infants had a significantly reduced risk of eczema and asthma.
Yeah.
So great. Sure, take that. That's easy to find over the counter.
Yeah, you can find it in CVS or Walgreens.
Absolutely.
Right,
anywhere. It's so easy now, right? This particular strain.
It's called Lactobacillus GG. We'll put it in the show notes.
That's right, yeah. The other thing too is really, we're so stressed, we're so busy nowadays, but really and truly, part of the prescription for pregnancy needs to be helping to support mom's mental health, because we know the transgenerational impact of prenatal psychological stress on your baby's risk for metabolic disease, obesity, heart disease later, even your grandchildren's risk. And so supporting that as much as possible. We don't have villages anymore, but we really need to, for mom, know that taking that time out to go for a walk in nature, to spend that 10 minutes, meditating while nobody is awake and your toddler's still asleep, all of that. It's not just indulgent. It's actually really, really important. It is medicine.
Yeah. So that's powerful. You talk about the gut reset program and the 5 things for microbiome magic in your book. Can you kind of unpack that a little bit?
Yeah.
And because, it's kind of in a way discouraging, because we're in a world where we've all taken antibiotics. We're exposed to things like glyphosate, which destroys our microbiome. A third of babies are born by C-section. The average little kid gets antibiotics in their first year of life. Like, it's just kind of a disaster in terms of the risk factors for messing up our microbiome. And it determines so much of our future health and so much of our children's health, even while they're kids, as you mentioned. So how do you think about this gut reset program that you talk about in the 5 things for microbiome magic?
As a pediatrician, I always try to approach things with some fun, some joy, some hope, because as you said, it can be like, oh my gosh, the world is against me. How can anyone be healthy in this world? And we can. So just empowering kids and parents to know there are simple steps that we can take to be healthy, and that, for our children, when we do that as a family, even if they push back as teenagers, right? The inevitable pushback, right? My kids are preteens, teenagers, and, there's going to be pushback. That's part of life, right? But if you lay those foundations, they're going to go back to it. The teenagers who, knew how to cook, right? They were much more likely to choose vegetables when they were off to college, right? It pays it forward. And so, the gut reset is really akin to the 5 R's of functional medicine on how to heal the gut microbiome, but the foundation. So the reset would be really, if your child has any sort of persistent health concern, and we have to presume if your child has a persistent health concern, chances are they have a leaky gut. Chances are they could have gut dysbiosis, right? Maybe not, but in an abnormal balance of bacteria, yeast, parasites, whatever else. Viruses that we're not really yet able to measure yet, right? But the foundation of that reset, so the R first RE, return, is returning to those 5 things for microbiome magic. Those are the fundamentals, the essentials. I mean, many people listening have heard the saying that you can't out supplement a bad diet and lifestyle.
Right.
Well, you can't heal your microbiome. You can't out supplement a poor diet and lifestyle for your microbiome.
Right.
I could tell you 10 different supplements to take,
Right.
and you might get a little better. And in fact, I've had kids, going through the gut reset when they're like, okay, not changing the diet. I'm not going to go to bed at, get 8 hours of sleep, right? They can get better on the supplement plan. And they can even, quote, go into remission. But here's the thing, and as practitioners listening, we've all had this experience where your patient gets better. I mean, that's awesome, right? They're in remission. But then what happens 6 months later?
Yeah, they slide back.
They start sliding back, right? I mean, what we want is, I don't want you to want to call it remission, right? I want to call it, okay, this is your new state of health. Right. This is your new normal now. Right. And so I have parents who are kind of, just holding their breath, waiting for the next shoe to drop, because they're like, okay, when's the next time they're going to flare, in their PANS, or when's the next time, that their rheumatoid arthritis is going to flare. So those 5 things, I had this opportunity. It was so fun for my kids. They go to a public charter school and rely on parent volunteers to teach some of their, quote, electives. And so for their 3rd and 4th grade combined class, so 8 to 10-year-olds, I created a 6-week curriculum. We call it Healthy Belly, Happy You. It was so fun. I mean, we taught all about their microbiome, but made it fun.
Poop with kids. I bet they loved it.
I mean, poop with kids, all about poop, right? And connected the dots to why they're these tiny little microscopic friends are so important for not missing school so much because you're sick, or getting along better with your friends, or being able to sleep
better
easier, better in school, running faster down the soccer field, right? So connected the dots. And these kids, they learned how to look at packages, read food labels, check the sugar, make sure there's nothing artificial. They were going home telling their parents, Mom, I shouldn't have more than 25 grams of added sugar in a day. And look at this. They have like this package of, whatever it is. Let's say boba tea, right? It's 35 grams of sugar. Now, some kids, of course, my kids too included, they may choose to have that, right? But at least they know they're making that informed decision, right? And then they know, okay, how can I get my microbiome to bounce back from that, right? We made kombucha.
That's so fun.
And sauerkraut. I mean, that's the way to do it, right? So we just spoke about the 5 things that they have to do every day anyway. So why not just do it for themselves, but for all their trillions of microscopic friends?
You're not alone.
You're not alone. You're not alone. And really and truly, the numbers keep changing, right? But whatever, 10 times more bacterial cells, on and in us than human cells. I mean, who are we really nurturing, right? And so, we have to eat every day. So why not eat to support your microbiome? We have to breathe and drink and sleep and move our bodies. Even if you're a couch potato, you're still moving, right? So how can we do each of those 5 things in a way that supports your buddies, supports you? And they were all into it.
I love that.
And, we go through each of these in the book, but I would say the 2 most important things are, number 1, nourishing your gut microbiome. And that includes what kind of things you get in. So we've already talked about that, right? Fiber, color, fermented foods. Prebiotic foods, right? Creating symbiotic meals, right? That means pairing, a fiber-filled food with a fermented food. So, just think like yogurt and, nuts and granola, right? Right there, right? Or blueberries on top. But equally important, especially for our kids who are, quote, picky, and for parents who are like, okay, they don't let a vegetable touch their plate. Like, I got to figure something else out. Sometimes even more impactful is to teach them how to read food labels to know what to keep out.
Yeah.
Right? The things that are really especially harmful to their gut microbiomes. And I don't make it too complicated, but, I really talk about these food additives. What was hilarious in doing research for the book? There are over 3,000 FDA approved food additives, right? And the list, it's called everything added to food in the United States. I mean, what a silly list, right? But over 3,000 to make our food taste better, sweeter, saltier, have a better mouthfeel. I mean, it's creepy,
it's
right?
Bad. And these things aren't really food, and they're mostly not regulated. They mostly haven't been tested.
Yep.
They're often not allowed in other countries, like in Europe.
That's right.
And we use them here right now. Kellogg is getting a bit of a backlash because it produces foods in America that have certain colors and additives that they don't allow in Canada and other countries, and they remove those from other countries' products that they sell, where they sell Kellogg's, but they don't remove it in America. So our kids are getting exposed to very harmful things that they're protected from in other countries.
It's true. They were big to do about getting rid of the artificial colors. This was probably about 10 years ago. I was really excited. And then they pulled back, right? They said, well, first of all, we're not removing those because they're actually harmful, right?
Right.
Second of all,
the
American people, they actually prefer the brighter colors and they prefer X, Y, and Z. I mean, come on.
They might also prefer cocaine in every corner in a dispensing machine.
It's so it is true. Europe already for years has had a warning label that, foods with artificial dyes and preservatives can affect children's behavior and attention and focus. And so teaching kids how to keep those things out, really impactful. And I'll tell you a quick story on just how we had before when we bumped into each other in the hallway and we were chatting about just how quickly kids can get better, compared to adults. And
it's true, yeah.
Kids aren't filled with all the the toxins, whether they're physiologic toxins or environmental toxins and psychological toxins. 100% more resilient. And so small changes can have profound results. And, there's this one kiddo, he was probably about 6 years old, tons of behavioral concerns, tons of sensory issues. He didn't feel right in his skin. He was getting into fights with every kid on his soccer team. Not a good thing. His occupational therapist was really astute and referred him to me and said, I don't think this is just sensory issues, right? There's something else going on.
Yeah.
Sat with a mom who was just, exhausted, at her wit's end. One of the things that was heartbreaking for her was her son.
Yeah.
He just couldn't stand touch. So when she would kiss him, he would wipe it off, right? He just moved away from her hugs. That's heartbreaking as a mom.
Yeah, of course.
And so as we sat and talked about different tests that we might do just to figure out, dive a little deeper, could there be some...
Yeah, what did you find?
Well, this kiddo did end up having PANS. Okay, so that's sort of, the backstory there. There was something different going on for his sensory issues. But what is
that you just said? PANS?
So PANS, pediatric acute onset neuropsychiatric syndromes.
Which is a mouthful, but it just means kids have these weird neuropsychiatric problems. We don't know what it is.
Yeah.
And it's called a syndrome because we have no clue how to deal with it.
That's right.
But we actually do from a functional medicine perspective.
Absolutely. Yeah. And for some kids, an abrupt, pretty dramatic onset of OCD, food restrictions, aggression, separation anxiety, cognitive decline, handwriting decline. PANS can have many different causes. So that's where, as a functional medicine practitioner, you need to do the digging because it could be mold, mycotoxins. It could be infections like strep. And when it's caused by strep, it's caused PANDUS.
Right.
So pediatric acute neuropsychiatric syndrome disorders associated with streptococcal infection. Yeah. That's another mouthful. But so he ended up having that. But here's the thing. After his soccer practices and games, often there would be treats of like the bright neon blue Gatorade, garbage, right? Yeah. And the Skittles and and the family otherwise was pretty healthy in terms of their diet. But it was just this thing that, well, it's a treat after soccer, right? All his friends are doing it. So, as we're thinking about the testing, I said, look, let's just do one thing right now. One thing. Let's just remove all of the artificial colors and preservatives from his diet.
It was like the Feingold diet, right? Feingold was this pediatrician back in the 70s who said food additives were causing ADHD.
And it's,
there was something to it. It's not every case, but yeah.
As a pediatrician, I think it's really important to not just say to do something, but make it concrete.
Yeah.
So we went through and figured out, okay, the Gatorade, okay, what's an equally acceptable, non-artificial, no artificial sweeteners either, no sucralose, no aspartame, hydration drink he can drink.
Yeah.
How about coconut water, right? But there are other hydration drinks that are much cleaner than the Gatorade, right? Sure. The Skittles, what could we replace that with? So we really concretely discussed what swaps to make.
Yeah.
And then she went home. She was a little overwhelmed by everything, right? As can happen in that first visit. It's like drinking from a fire hose sometimes,
Sure.
but she was committed. And mom took out the artificial dyes, sent me a message 2 weeks later.
Yeah.
2 weeks, right?
Yeah.
2 weeks. I have the message from her in my portal, and it makes me tear up every time I think about it. And she said she just wanted to thank me because for the first time she could remember in so long, he didn't wipe away her kiss. Right?
That's
for the
amazing.
first time.
That's amazing.
And he even asked for a hug.
That's amazing. Yeah.
Right? So, I mean, 2 weeks is not that long. And so that's where the mindset shift has to happen, because a lot of people think, oh, I'm depriving my kid. Or maybe it's like your
You're
partner
helping
or
your
grandma.
kid.
I mean, we're not depriving your kids, right? We're helping
Yeah.
them thrive.
I mean, I want to pause there for a sec because what you said was just so important, that there are these kids walking around with all these health issues that are treated by traditional medicine, usually with medications or with nothing. Like there's no treatment for sensory issues with kids. It's just like, behavioral therapy or other kinds of therapies that really don't work that well. And what you're saying is that there are underlying biological causes of many of the things that are correctable, and that kids respond really quickly and really well to these things in ways that sometimes adults don't. So being a pediatrician has to be extremely satisfying when you're using this approach. When you're not, you're just kind of putting Band-Aids on everything. And it can be very frustrating. I think pediatricians have one of the lowest job satisfactions and the highest burnout rates. And it's because they're really kind of just on this treadmill of traditional care, which isn't actually helping their patients. Your case reminded me of a boy I took care of who was 12 years old, who was so disruptive, severe ADHD, kicked out of kindergarten. I mean, who gets kicked out of kindergarten?
I know, right? Yeah.
Was on ADD medications. And he had all these other issues that were not, quote, psychiatric, right? He had stomach aches. He had anal itching. He had asthma. He had allergies. He had headaches. He had anxiety. He had insomnia. Like he had
all the things.
Muscle cramps. I mean, he had all these things that were really problematic, but were treated by all these different specialists. He was on 7 different medications.
Yeah.
And what we found was that he lived on a diet of processed food. And we did a bunch of testing. And I want to talk about testing because I think it's an important thing for how do we sort of figure out what's going on with our kids. And we did a number of tests, and we found he was severely nutritional deficient in almost everything. Vitamin D, B6, magnesium, zinc, just like omega-3 fats. He had high levels of all these trans fats in his blood. He had, from all the processed food, he had high levels of inflammatory fats. He had high levels of really toxic stuff in his system like lead, and his gut was a mess. He had overgrowth of yeast and leaky gut and food sensitivities, and he had gluten antibodies from eating gluten that he was sensitive to. And all I did was really do what you're talking about, was reset his gut, put him on a whole foods diet, got rid of the bad bugs, put in some probiotics, get him the nutrients he needed, a multi-vitamin D, fish oil, zinc, magnesium, B6. 2 months later, the mom brought him back and said he's a completely different kid. He's got no ADD. He's off all his medications. He has no more headaches, no more stomach aches, no more asthma, no more any of the other things he was suffering with. He stopped drinking all the sodas and everything, and was drinking all the junk food. And his handwriting, which was the thing that blew my mind, went from completely illegible to completely perfect penmanship.
Yeah.
And I was like, wow, like this is crazy. When you see something like this, you go, as a doctor, you go, either you dismiss it because it doesn't fit your paradigm, or you go, wait a minute, there's something I've been missing. And that the body and the brain are connected in ways that are so important. And so whether kids got sensory or behavioral issues, or whether the kids got allergic autoimmune issues, it's so important to get the proper evaluation. So how do you start to think about looking at these kids who are stuck? One is prevention, right? We talked about that. Getting the mother's health and the father's health, great preconception. They both need to be on the right supplements, correct the things that are off, fix their guts, get rid of the metals, all the things we talked about. And now you can listen to the podcast on Preparing to Conceive, because it talks about what to do for both men and women. But then we have all these kids who are suffering, and these kids with chronic illnesses, these kids who are on multiple medications and who are stuck in this treadmill that they're on for life, and that are going to have consequences their whole life long from these conditions. And then maybe allergies turn into autoimmunity when they get older, and it's just kind of a mess. So when you have these kids who come in to see you and they have, ADHD or autism or autoimmunity, or they're allergic to everything, or they have eczema, how do you start to think about assessing these patients and helping these parents think about taking care of their kids in a different way?
With the child present too. I mean, I always want to educate and inform kids in an age appropriate way. So I think that's where making sure kids are on board with the whole plan is really important, that they understand.
Yeah, of course.
Because if mom comes home and just says, okay, we're going to overhaul your diet and all, I mean, it's not necessary. For some kids it might, but for many kids it's not going to work, right?
I'm kind of showing the kids their test results. Like, here, look at this, you're allergic to gluten. Or look at this, you've got,
Across the board, when I tell parents and kids, when they're sitting in front of me, if they have any sort of attention concerns, behavioral concerns, focus concerns, anxiety. I mean, so many kids are suffering from anxiety nowadays. And when I tell them that 80 to 90% of the serotonin in their bodies is made by their gut microbiome, right? And then usually there's a pause and parents and kids are like, what? Right? So that's a perfect segue into, listen, let's think about all the things that are happening that are disrupting your gut microbiome. And so that's an easier in to say, let's look at the foods, right? It's not just about like what you're eating. It's about, okay, what factors are, harming your gut microbiome, and, guaranteed no matter what kids have, we can kind of link it to that. That's an easier way, I think, to have a conversation around food.
Interesting.
And you have to work with their goals, right? For parents, it might be, to
what do they want? They want to feel better.
What do they
want?
Exactly.
They want to do better in school. They want to.
Yeah. The foundations, as you said, I mean, we always talk about the foundations of food as medicine. That sometimes is the hardest thing to change, honestly, right? For a lot of kids. And talking about, I mean, even for this one teenager who came in and he's been gluten-free on and off. And he knows it makes a huge difference for him, but he was having a flare of his
sometimes the kids just want to eat that pizza.
Well, so he was having a flare, and he came to me and we did some testing. He's like, just please don't tell me I have to go off the gluten. And I'm like, look, I'm not going to tell you have to, but I'm going to tell you, what decisions are going to help serve your body and your brain and make you feel better, right? And he took some time to think about it. And of course, I expect that in a teenager, right?
Yeah.
But especially for teenagers, I let them know that we're working as a team, and the decisions you make, I mean, teenagers, they're all about, trying to be an adult. I'm independent, but if you're going to be given the opportunity to make adult decisions, then you have to make them like an adult and make them with information, right? But the foundations really, in healing the gut are, the foundations, right?
But do you test kids? I mean, do you do testing and diagnostics?
So I do. I mean, the first thing I'll test is blood work for nutrient deficiencies.
So what do you
have
look
to
for?
optimize. So the foundations are the CBC. I do a ferritin, complete blood count, a ferritin,
which looks at iron.
That looks at iron stores. I'd like to do a comprehensive metabolic panel that's fasting, because I want to see what their blood sugar is doing, even for fit, active, slim kids. So many more kids are showing signs of insulin resistance.
Yeah,
right.
Pre-diabetes in kids, right?
Yeah, even for kids that don't fit the overweight
And you measure
profile.
the insulin levels?
So I
kids?
measure fasting insulin, fasting blood sugar in the comprehensive metabolic panel. I look at their liver enzymes specifically too, because AST and ALT can start to creep up. I do hemoglobin A1C, but that's rarely high. I mean, because it's just the average blood sugar, right? So if most kids are kind of roller coastering up and down, right? So if they have low lows and high highs, their A1C might look perfect, right? I do a red blood cell zinc, a red blood cell magnesium, 25 hydroxy vitamin D. So those are kind of my foundations.
Omega-3s?
I do an omega-3 profile. It's not always available, but I do add that omega-3 and my omega-6 profile. So, and also for the young kids, you can only take so much blood at a time.
Yeah.
But those are my foundations. Lately, I've been, really trying.
And are you seeing a lot of nutritional deficiencies in these kids?
100%.
100% of kids have nutrition.
I mean, I'm not going to say 100%, maybe 99.9%.
Okay, that way,
right.
Just stop right there. Stop right there. So what you're saying is, in the world's most affluent country, where you're probably seeing a fairly high-end population of people, not people who are highly underserved.
Many who are already healthier.
Already, quote, healthier. Parents are very proactive. They're coming to see you. In this population, you're seeing almost 100% of kids have one or more nutrient deficiencies.
And I'm going to say, I'll back that up a little bit and say nutrient deficiencies and insufficiencies.
Yeah,
right?
So
because,
not optimal levels.
Yes, so suboptimal, bottom of the barrel, right? And the most common is zinc.
Yeah.
Okay, zinc is the most common nutrient insufficiency and deficiency. Sometimes it's shocking how low of red blood cell zinc is. If you were to eat, you'd have to eat the equivalent of 8 oranges today to get the nutrients that your grandma had with 1 orange. I mean, it's probably not quite as simple as that, but our food is less nutrient dense. It's depleted from the glyphosate, from
we're not talking about processed food. We're talking about like fruits and vegetables and food that should be nutrient dense, right?
So that's why even kids who have the quote healthiest diet, it's not uncommon to see these nutrient deficiencies.
And by the way, what you're talking about, Lisa, is not something that most doctors or pediatricians will check. They don't check nutrient levels on kids. No. It's just not done. Maybe you'll check an iron level on a little kid, but that's really unusual.
It's unusual. For parents listening who are thinking, there's no way I'm going to get my kid to do a blood draw, there's a lidocaine, prilocaine numbing cream that is magic. You put it on your elbows, and I mean, kids just
Is that EMLA?
EMLA. It's EMLA cream.
EMLA.
Yep. I would highly recommend that, at least that first blood draw, that you use EMLA so that your kid doesn't feel the poke, and just have a distraction, right? Yeah. This is screen time has a pass for this, where they can watch Dora, they can do whatever, right? So our food is depleted. Ultra processed foods deplete our nutrients even further.
Explain why.
Well, so some of these kind of anti-nutrients, right? I mean, they compete with absorption for our proper nutrients, even if we're kind of pairing it with healthier foods. And ultra-processed foods, they're devoid of most nutrients anyway.
Yeah.
So the thing with the ultra-processed foods is when you read labels, I used to say, if you can't pronounce something, put it back. But some of those things are things like riboflavin and methylcobalamin.
Well, they add them to enrich
but they have
foods.
To add back vitamins and minerals.
Right. I always say they're enriched because they're so impoverished in the first place. They have to eat.
That's right. Why would you need to add back nutrients to a food, to a real food, right? And I also think our kids have a higher need for nutrients.
Yeah, because more stresses, more toxins.
Less nutrients getting in, more use of them. Because psychological stress, you need zinc, you need magnesium as cofactors for many of your neurotransmitters. You need your B vitamins. All of these are getting depleted.
Also, when you eat ultra-processed food, you're not getting all the cofactors that you need to metabolize that food. So basically, in order to process your food in your body, you need a lot of vitamins and minerals to run the chemical reactions to turn the food into energy and do everything else. So you're kind of in a double whammy. You're not getting the nutrients, and you need more of them.
I mean, it's like a double, triple whammy. It's and zinc especially. Just as a little pearl for parents listening and for practitioners, if you have kids who are super picky, sensory, cover their ears when they're in a public toilet, or the kids have to leave if they run the blender or the vacuum, or maybe they know to buy seamless socks or to cut off all the tags on the shirts. So if you have a kid like this, you know exactly what I'm talking about, right?
Yeah.
And that can be one of the most challenging things. Well, zinc deficiency alters your taste profile, so it can trigger pickiness,
picky eating, right?
Low appetite. Also, there's amplification. It's called auditory gain, where sounds sound louder. The sensory issues, the tactile tags, socks, shoes, all of that. If you have a pediatrician or a physician who is not ordering tests for you, or you're not able to find a practitioner order test, sometimes just supplementing with a little extra zinc, and parents will say, oh my gosh, they got out the door in 5 minutes, not 20, because I had to tie their shoes over and over again because they weren't tight enough, right? Or palate is actually expanding a little bit. It could be as simple as that, but knowing that zinc is one of the most common nutrient deficiencies in kids, it can be so profound. There are clinical clues that kids may be deficient, but I always look at that.
You ever use a zinc taste test?
The tally?
Sometimes
it's harder for kids, but yes.
You basically take this zinc liquid, and if you don't taste anything, then you're deficient.
That's right.
So instead of doing a blood test, you can actually do just like a test in the office or at home.
Totally,
with zinc sulfate, So this is amazing. So that sort of speaks to the need for supplements, because you think, kids are healthy, they're young, well, they don't need supplements. But do kids need supplements? And if so, what supplements are non-negotiable? And what should kids be taking?
Especially if I don't.
And not Flintstone vitamins.
Not Flintstone vitamins, please. If I have the opportunity to check lab work, then I will supplement individual nutrients based on the lab work. Many kids are going to have, especially if they have chronic issues, they will have issues with methylation and need more methyl factors. But I have yet to see a young kid with an elevated homocysteine, maybe on their urine. So I will do urine organic acid tests because they're so much easier to get. So much easier to get a poop test than a blood test sometimes, a pee test than a blood test sometimes. If we want to look at methylation stress, you can look at methylmalonic acid or fig-glu for miminoglutamic acid, right?
And these are just markers of folate or B12 deficiency that you can see in the urine.
Yeah. And then, even on stool testing, if I see inflammation or digestive insufficiency, right? They're not absorbing their fats or, their proteins or their carbohydrates. I might do digestive enzymes. But across the board, I would say virtually all kids need extra vitamin D. Even in the middle of summer, when kids are out at summer camp and they have that golden tan, even then when I've measured kids, they are not optimal.
Yeah.
Right.
That's true.
So, and in the Northern Hemisphere where we live, apart from summer, you're really not going to get enough conversion through your skin in any other season.
And unless you're running around half naked in a bathing suit for, at least half an hour a day from 10 to 2 in the afternoon.
Not lathered in sunscreen.
You're not going to get exposures that are going to make a difference.
Yeah.
Maybe if you're a lifeguard, you'll be all right. But
so that might be fun.
Yeah.
But so almost all kids, and I would bet their parents to need vitamin D, so vitamin D3. Do they need K2? I'll add K2 when they get older for sure, for teenagers. Almost all kids need an omega-3, a fish oil, right?
So important for ADD, depression, skin health, hair, all of it.
Yeah,
immune
and
health.
their kids' hormones. If kids have atopy, eczema, or asthma, I'll make it a 369 fish oil omega-6 supplement with GLA. So that's an omega-6, guys, found in borage, blackcurrant, evening primrose. It's really good for autoimmune and atopic conditions.
Yeah, people think all omega-6s are bad. They're not. They're not good or bad. It's the quantity we have, and it's certain types are actually really beneficial, like you're talking about GLA, which is from evening primrose or borage oil.
Yes, so important. So I would say those are my staples, and I will say I am forever on the hunt for a high quality children's multivitamin that I love.
You haven't found one?
I mean, I found a few that I'm okay with, right? And none is perfect, but there's some that are better than others.
Yeah.
What I would move away from are some of the over-the-counter
Gummy vitamins.
Now some, like we carried a gummy line that was awesome because each gummy only had 0.5 grams of sugar. But some of them, if kids are getting the gummy vitamin D and some extra gummy magnesium and, gummy vitamins, I mean, in that like handful of gummies that they're gladly chomping away on, before they head off to school, they might have had like 4 teaspoons of sugar in that one sitting. Right. And so we don't want to send our kids off with a mouthful of sugar.
And how do parents go about finding good products like, omega-3, vitamin D, a multi, maybe zinc if they need it, magnesium, probiotics? I mean, it's kind of a zoo out there to find the right.
It is kind of a zoo. I mean, I use the practitioner brands, right? Because
but now they're available to consumers.
That's
often,
right.
Like pure encapsulations or
Designs for Health now is available to consumers. I think Zymogen now is available to consumers. So it's much easier to find. And what I tell folks is either purchase from your practitioner who is, storing, handling things well. If you're going to buy from Amazon, make sure you buy it from the manufacturer's store, not from like Judy's health food store.
Yeah, because a lot of these, like they might buy a lot that's almost expired. They might have it sitting on the tarmac, in a warehouse that's at 120 degrees, and it's a problem out there. So you have to be careful for products you buy on Amazon. I want to sort of dive into a topic. We talked about the gut, we talked about diet, we talked about testing and supplementation, and there's so much more in your book. Healthy kids, happy kids. Everybody who's had a kid, is going to have a kid, or is going to have a grandkid needs to get this book. Let's talk about a controversial subject here, which is vaccines, because it's the question I probably get most, which is, should I vaccinate my kid? How many vaccines should I get? Should I get all of them? Should I get none of them? Should I get some of them? When should I get them? What's the schedule should I take them on? Are they safe? Do they cause autism? And one of the challenges in medicine today is that it's become a bit of a religious phenomena in the conversation. It's not a scientific conversation anymore. And I want to have an adult conversation about vaccines because they are like any other intervention in medicine, whether it's Tylenol or aspirin or even a supplement. It's an intervention that has potential benefits and potential risks. And for some reason, we're not allowed to talk about any of the risks in medicine. Yeah. It's literally heresy. I was at Cleveland Clinic and I literally had to write a public statement saying that I was not against vaccines.
Oh my gosh.
By the Pediatric Institute, because they somehow kind of got wind that I talked about some of the challenges in vaccines. And I was like, wow, this has gotten to be almost like pro-life, pro-choice, Republican, Democrat, Arab, Israeli. It's like, wait a minute.
Yes.
Like, this is not so polarized. We have science. We can talk about these things intelligently, and they're not all good. They're not all bad. And what's happened in since I was trained is that there are so many more vaccines than they were, and there are so many more recommended. And I just want to sort of lay a little bit of the stage for people because I remember getting recertified for my board certification. And I went to a UCSF prep course because when you kind of forget stuff, so you go to like a week-long prep course to kind of refresh your memory about it.
Here's what you have to refresh your memory about, right? It's the conventional stuff that you're not doing anymore because there are other functional ways.
Yeah, but even even so, I mean, it was a good background, and it was really like, what are the latest things we should be doing? And a pediatrician got up from UCSF, and this was probably like, oh gosh, it might have been 15 years ago more. He got up and he said, here's the vaccine schedule that's recommended now. But I got to tell you, this is a lot of vaccines.
Oh.
And I'm like,
wow.
I was like, he was kind of almost sheepishly saying this was the standard of care recommendation. And, there were 8 jabs that kids got. Now there's I think 70 plus vaccines they can get. And part of that had to do with the indemnification of vaccine manufacturers who basically were going to get out of the vaccine business because it was too risky, it was too hard to do studies. And so the government said, no, we think vaccines are important. We're going to protect you. Mm-hmm. You guys go ahead and do your discovery. You make the vaccines. We're going to take all the liability. So we're going to, if somebody sues you, they can't sue you. They're going to have to sue the government, and we're going to settle in vaccine court. And there's over $5 billion of settlements in vaccine court for vaccine injury. So it's not like a trivial thing. There's whole fields now of scientific inquiry around vaccinomics, which is understanding how you match your vaccine schedule or your dosage or your type to your particular genetics. And so I think we need to have this sort of intelligent conversation because people hear vaccines cause autism. Well, no, they don't. It's a whole consequences of different insults that maybe make kids predisposed when they get an insult, whether it's an infection or some kind of stress or a vaccine that then triggers something. But can you talk about, as a pediatrician, how you help parents navigate this landscape of vaccines when they're come to you with their first baby visit and throughout the early childhood years? How do you advise them to think about this and to customize this approach to intelligent vaccine use?
I love so much of what you said because really, I mean, in our kind of modern day of medicine, where hopefully we truly are moving more towards precision, personalized medicine, why not have that same approach to vaccines? It has become a bit of a religion, and simply by
heresy. You get canceled if you say anything against vaccines. That's right?
Yeah, and you're almost if you just want to have a discussion, you're immediately branded as 100% anti-vaccine. Which what I've always told.
I'm pro-science. How about
that's
we
right. That's right.
My friend once said, I'm for safe planes. It doesn't mean I'm anti-flying.
Yes, 100%. I mean, that's what I tell families is, look, I am not 100% vaccine or 100% anti-vaccine. What I am is 100% your child, right? And that is the only thing that is important here. And what we need to do, just like everything else, I mean, even with medications, we know with some of the genetic SNP testing that this little child might actually need a higher dose of a certain medicine than a full-grown man because of the way they metabolize, right?
Yeah.
And so, just as you said, vaccinomics is this field that is trying to figure out how to make vaccines more effective based on your genomic profile. Adversomics is the flip side, which is not. There are many fewer or way fewer studies on adversomics, which studies the genomics behind who may be more at risk for adverse reactions to vaccines. than there are on vaccinomics, but we need to get there, right? And we're not there yet. So how do we then think intelligently about what is right for this one child?
Yeah.
And this is where we have our public health, outcomes that we'd like. But when you're in the office, you're looking at this individual child, right? And so we have to look at family history, because we know that certain vaccines like hepatitis B is in the literature known to temporarily cause a skewing towards autoimmunity.
Yeah.
So if I have a child in front of me where every single family member has some autoimmune disease, am I going to be more worried about them getting hepatitis B, especially at that young, vulnerable age when they're an infant? Maybe, right?
And that's a vaccine that is protecting against a disease, hepatitis B, caused by intravenous drug use and sexual activity. And we're giving it to babies in the hospital the day or two after they're born. Why? Because we have them captive and we might not get them back. But it makes no medical sense.
It would maybe make medical sense if, mom or someone in the family had
right.
hepatitis B, right? But apart from that, it's true. So this is also where we have the science, and then we need to really let our logical, more rational part of our brain kick in. Why would a newborn who doesn't have risk factors for contracting hepatitis B need it right then and there? Could they wait until they're, preteen teenagers thinking about becoming sexually active? Like, why not? And that's what I always ask my pediatrician friends who maybe are not on the same boat. Like, if you can explain to me a compelling reason why a newborn who has zero risk factors should get this right then and there, and we know that they're not going to get lost to the healthcare system, they're reliable families, then tell me, right? The other thing that we really want to think about is, from a logical standpoint, that infant hepatitis B dose that, as you said, like a 1-day-old would get, is the very same dose that in my office I would give to a 17-year-old, teenage football player who weighs 200 pounds.
Right.
So you have 7-pound baby on one hand, 200-pound teenager, young adult on the other hand, same hepatitis B dose. So that also doesn't make sense to me.
Right.
So as I kind of walk through and I think about what do kids need to get for maybe daycare, school reasons. And for some families, they don't have the option to stay at home or, homeschool their kids or move to another state, let's say, if your state does have more restrictive vaccine policies and don't allow you to choose a more flexible schedule for your child. Well, our hands are kind of tied then.
Yeah.
So the way I try to really think about it is, when I give vaccines,
it's sort of interesting that the state is interfering in medical decisions.
Yeah,
I think that's
absolutely. I mean, this should be.
It's like imagine the government deciding which statin you should be on, or which blood pressure pill you should be on, or when you should get it, or it's kind of odd, right?
Yeah,
and it's a public health issue. I get it, but it's a little bit heavy-handed, and I think one of the things that I have a challenge with the vaccines, and I think we talk about evidence-based medicine. Now, each of the vaccines have been tested in single vaccines for relatively short periods in small groups of people. So we don't really know how they work long-term in large groups of people.
Yeah.
But what's not done, and this, I think we don't practice evidence-based medicine in this context, is we've never looked at the concoction of all the vaccines in the dosing schedule that we've given to kids when you give so many vaccines at once, and what that does to their immune system, to their biology, to their proteomics, to their metabolomics, to their epigenetics, to their immune system. We don't even look at it.
Yeah.
So essentially, we've vaccines are safe. We don't need to study them. End of story. Just give them, and it's just the most unscientific thing. I mean, I think vaccines have been one of the most beneficial things that humanity's ever discovered. But do kids need every single vaccine from the minute they're born? I don't think they do. They need the important ones.
Yeah.
Right?
I mean, to your point too, same thing with environmental toxins or ultra processed food ingredients. Maybe we've tested in isolation each ingredient or each toxin, but not the concoction, as you said. And many are found to have harmful synergistic, meaning it's not just 1 + 1 = 2 bad. It's like 1 + 1 might equal 10 times the bad. So, when we think about this vaccine schedule, what I try to work with families on then is I like to do one at a time, right, at first, right? Because then if a child is going to have a reaction, we know exactly which one the reaction
So you don't, like, for example, a lot of these vaccines come in cocktails like MMR, measles, mumps, and rubella, or tetanus, diphtheria, and pertussis, like DBT. So how do you deal with those cocktails?
So that's a great point, because with those, we don't have an option.
Yeah.
There used to be a separate M MMR. Now there's only just MMR. And the Tdap, you could potentially get tetanus separately, but it's hard to find, right? I would say one grouping. So polio separately, DTaP separately, MMR separately, varicella separately. If given the choice, I do think, knowing how profoundly a baby's immune system changes in that first month of life, first 3 to 6 months of life, first year of life, if we can wait a little bit just to let their immune system start to do its thing, set a good, healthy microbiome, if only for the fact that we know that an optimal gut microbiome can improve vaccine efficacy. So if that's our only goal, then even
that's a
right?
really profound statement you just said. Let's get the kids healthy and optimize their microbiome before we start vaccinating them. And that should start even preconception.
Yes.
Right? And then when the mother's pregnant, taking her probiotics, and then maybe getting the baby Bifidobacterium infantis early on, and the right prebiotics that you mentioned.
Yeah.
And let's get their guts healthy. And what I've seen is kids who are somehow compromised are the ones who have trouble with vaccines. Kids who have had tons of antibiotics, ear infections, who have gut issues, who have these kinds of problems early on, when they get vaccines, they're the ones who tend to have the issues. Do you see that?
Yes and no. I would say my population, my patients, we work so closely together around vaccine schedules, and I support them. I give supplements before and after to help them with their methylation. And we know a lot of these vaccines can stress the mitochondria. So I provide mitochondrial supports. I optimize their nutrient levels. I make sure they're getting vitamin D. And, many of these vaccines will have not just aluminum, but formaldehyde and other ingredients. So how do I get them to clear that out faster? Well, I'm making sure they're taking extra glutathione and vitamin C and Epsom salt baths. So, knock on wood, most of my kids do so well and I really do think it's because we've prepped them. We allow space in between vaccines for the body to do its thing, hopefully mount an effective immune response, because that's why we're giving the vaccine anyway. Settle back down to baseline before we do the next one.
So are there any resources for parents, people listening, that they could go to learn about how to do this more intelligently and scientifically?
Okay, I'm going to be totally honest. It's been hard for me to be able to share a lot of this publicly, right?
Because you get canceled. Right.
Just that's the truth of it. I do, at practitioner conferences, I try to teach practitioners the science behind different vaccines, what we know about adversomics, what we know about vaccinomics, what supplements may be beneficial, what lifestyle factors, because we know exercise before and after vaccines may reduce vaccine adverse reactions while improving efficacy. A good night's sleep, they found the sleep 2 nights before actually improves vaccine efficacy, reducing the sugars around. So I try to help other practitioners so that they can help their individual patients. But then I know that there are some physicians who have, vaccine online education programs for families. I haven't taken them, so I don't know what exactly they say. I do think that they're on the same page as I am, that it's not a never, it's not a follow the schedule 100%. It's a let's be smart about this and evidence-based and personalized.
Yeah. And there's a colleague of mine years ago, she wrote a book, it was quite a while ago now, 2001, called What Your Doctor May Not Tell You About Children's Vaccinations, as a guide to understand, how to make knowledgeable, responsible, science-based choices about vaccinating their children. So I encourage people to check that out. It might be a little dated, but I think it's probably still, and I think there are so many more vaccines than even when that book was written.
Yeah, for sure.
So it's kind of crazy, but you're really such an incredible resource for parents. I was joking before when we were going to get a snack. I said, you're kind of like the new Dr. Spock. For those who don't know who Dr. Spock was, he was a doctor in the 60s, and all parents read his book, Dr. Spock's Guide, Raising Your Kid. I remember what the title was. I met him actually when he was in his 90s. Really, really cool guy. Yeah. But he, my mother read that book. I was at home, and every parent had it. So every parent really should go out and have this book, Healthy, Happy Kids. You can get everywhere books are sold. You can go online and you can find the book at healthykidshappykids.com. Check it out. It's called Healthy Kids, Happy Kids, an integrated pediatrician's guide to whole child resilience. And that's really what this is about, making your kids resilient so that they don't have to suffer from so many of these childhood problems that we're seeing, from allergies and autoimmunity and gut issues to ADD and autism to learning disabilities to autoimmunity and in mental health disorders, depression. All these things are related to these things we're talking about. And we in traditional medicine, we treat them all as separate little individual issues. But if you get to the root causes, which we're talking about, which is your nutrition, your gut health, your nutritional status, toxin levels, and many things that we can actually do something about, then these kids get better, and they're incredibly resilient, and they respond really well to these approaches. And it's I've seen just so many miracles in my practice. I know you have too. When you start to apply this, it's really satisfying. So parents out there listening, if you're struggling with any health issue with your kids, just immediately go get this book right now.
Oh, thank you so much.
And Elisa, thank you so much for what you've done to bring this field forward, being an advocate for a functional medicine approach to pediatrics. We really need you. The world needs you. And thanks for everything you do.
Oh, thanks so much for having me.
If you loved that last video, you're going to love the next one. Check it out here.